We hear a lot of talk about cutting the cost of health care, but now a medical group is actually trying to do something about it. The American Board of Internal Medicine Foundation recently launched the Choosing Wisely campaign. It focuses on unnecessary medical tests and treatments. 9 groups of specialists each contributed a list of 5 items they believe are overused. Among them, antibiotics for sinus infections, MRIs for back pain, and electrocardiograms and stress tests for low-risk patients.
How are you feeling?
Feeling good. Yeah.
By a certain age, many of us have had a stress test, which measures the heart's reaction to exertion.
All right, let's inject now.
A nuclear stress test, like this one, includes injection of a radioactive agent into the bloodstream, so doctors can later see images of the stressed heart and arteries. It's a popular and expensive test.
A lot of time patients, even they have no symptoms, or sometimes physicians, even if their patient have no symptoms, they feel better if they get them.
The new Choosing Wisely guidelines suggest that in most cases, only patients showing symptoms of heart disease be candidates for stress tests.
It's darn good for patients with symptoms, but it's not as good for patients without heart disease. Most often when these tests come back positive, they're false positive, they're not truly positive. And when that lead downstream to more testing with procedures that involves more risk, without proven benefit that this will make patients live longer or feel better.
Dr. Rami Doukky helped write the Choosing Wisely guidelines for nuclear cardiology.
The idea is not to create laws, the idea is to create guidelines to guide physicians of appropriate use of diagnostic and interventional procedures and keep the physicians and healthcare professionals in charge of the process rather than somebody else, such as the government, and at the same time reduce cost.
I was talking to a friend of mine, and she said that her cardiologist suggested a stress test.
Obviously, every patient is different, so I don't know the specifics of your friend.
66-year-old Verdell Henderson is a longtime patient of Dr. Doukky's. Under Choosing Wisely guidelines, she is not a candidate for a stress test.
I'm not particularly convinced that you really would benefit from a stress test. The reason being that, for one, you do not have much of symptoms. You do not have any chest discomfort, you don't have any trouble breathing, any chest pain. And if this stress test, let's say, turned out to be positive, the chances are it will be a falsely positive test.
There are similar issues in nearly every specialty, including gastroenterology. Its guidelines recommend a 10-year interval between colon cancer screenings for most patients.
Polyps are small growths of the inside lining of the colon that 1 out of every 4 men carry with them and don't know they have them. Patients live in fear. The fear of cancer is a very significant one. And a patient may have had a colonoscopy 5 years earlier, and then a relative or friend comes down with colon cancer. Well, for many of these people, the first thing they do is call their doctor. Doc, is it okay? Can I wait? Don't I need a colonoscopy now?
Dr. Lawrence Kaczynski helped write the Choosing Wisely guidelines for fellow gastroenterologists.
And it's much easier for the physician to say, oh, sure, come on in, we'll do that colonoscopy. But, by the way, somebody's going to pay for that, and complications can ensue. They should only be done appropriately and according to guidelines that are established. If we don't find anything, you won't have to come back again for 10 years.
The Choosing Wisely guidelines suggesting colonoscopies every 10 years for patients with no previous polyps or family history is actually not a new standard.
We have had these guidelines in place for many years, but people stray. Instead of 10 years, it's 7. Instead of doing nothing in that interval, stool is checked for various reasons for blood, which then precipitates the ongoing escalation of testing and testing and testing, almost always to no avail because a good quality colonoscopy has been done.
A lot of time goes into the culture of practice. When the culture of practice expects you to do certain things for certain type of patients, the knee-jerk reflex for a lot of doctors is to do what's expected of them. And not necessarily because they agree with it, because that's what kind of, in a way, the society demand, and that's what the expectations are.
The Choosing Wisely campaign is kind of unprecedented because you have, for the first time, a group of physicians coming out and making recommendations of things that physicians shouldn't do rather than what they should do.
Catherine Nix, a health policy analyst at the Heritage Foundation, worries that the Choosing Wisely campaign could lead to added government requirements.
Under the Affordable Care Act, there is, of course, the concern that recommendations that are well-intentioned like these would be used as requirements by the federal government to create recommendations or requirements that physicians must abide by.
I disagree with that. There's nothing in the guidelines that we came up with that changes the practice of medicine. There's nothing there that alters the way I approach a patient. It just reaffirms to the doctor and to the patient that that procedure they had done and was done appropriately gives them a set period of time where they don't have to worry about this illness. Excellent, excellent, excellent.